Bhavna, Vedhara, Chairwoman, CII IWN Delhi. I would request you to kindly keep your cameras off and your mics on mute. Please feel free to write your questions in the chat box, and we will try our best to, take up each and every question and try and address your queries. Over to you, Bhavna.
Thank you so much, Rinki. And a very warm evening, good evening to everybody joining us at CII IWN's Need of the Hour. We have with us Dr. Alok Chopra, who is the Medical Director and Co-Founder. Can everybody please mute themselves? Thank you so much. So let me just start that again. We have with us Dr. Alok Chopra, who is the Medical Director and Co-Founder of DAIVAM Wellness, an MD and cardiologist at AASHSLOK Hospital. Dr. Chopra, it is indeed a it is a privilege to have you on our platform this evening.
Thank you.
Thank you for joining us. So Dr. Chopra, I know you are a practicing cardiologist and emergency medicine specialist. And I know that you are also practicing functional medicine. And I know we're sitting in the midst of a pandemic. So let's just, so I'm going to open the floor to you and say, can you?
You've got muted.
Sorry, hi. Did you hear my introduction?
No, just the last 20 seconds or something.
Okay. So good evening, everyone. A warm welcome to everyone joining us this evening. And it is indeed a privilege to have you with us, Dr. Chopra. Today's talk is going to be on COVID, treatment through functional medicine. Dr. Alok Chopra is the Medical Director and Co-Founder of DAIVAM Wellness and MD and Cardiologist at AASHSLOK Hospital. Dr. Chopra, a warm welcome to you. It is a privilege to have you on our platform. Thank you for joining us.
Thank you.
Okay, so Dr. Chopra, I know you are a functional medicine specialist. I know you are a practicing cardiologist and an emergency medicine specialist. We're sitting in the midst of a pandemic. Where do we start? What is functional medicine? How is it connected to allopathic medicine? And how can we integrate it in COVID?
Well, I've been involved in mainstream medicine from 35 years now, and I have practiced emergency medicine, and I still carry on. So I don't want to be viewed as a traitor in the ranks of mainstream medicine, because that's what I do most of the day. But medicine that I practice now is actually a take from mainstream medicine. The only difference is that we do not use pharmaceuticals. That's a small but a very big difference. So, the problem is that modern medicine, despite all its wonderful miracles, saving lives, someone has a heart attack, breaks a bone, septicemia, organ transplant, I mean, nothing in the world can match that. And currently, how many lives are being saved in the ICU because of the COVID? But problem is that despite this, there's modern medicine is under attack, spiraling costs, man-made and treatment-oriented illnesses, many places being run by self-serving priorities and biases. So we are so mesmerized with this technology of modern medicine that we have forgotten the miracle technology of our own mind and body. And the more we have invested in this miracles, we have disinvested in our humanness. So that comes to the question of chronic medicine, which means that what is upsetting me is that we are treating chronic illnesses, namely cardiometabolic disease, heart disease, diabetes, autoimmune diseases, aging, and cancer in a very slipshod manner, because we are really at sea. Why we are doing that is that we are putting a person's diagnosis by a mere definition of symptoms, filing it and tabling it and adding 5 milligrams here or 2 milligrams there. So one fine day, a particular incident made me feel that very bad, and I felt the angst of the people and the chronicity of the illness, and something in me, sort of compassion rose inside me that this is not the way we would like to treat people, and some form of service and some form of change has to happen. So that night, I sat with a new moral rectitude, literally, and I said that let me do something which is different and find out what was the root cause of these illnesses so that I can, manage that. From that day, we started this new protocol. This is not this is not an alternative or complementary medicine. It is coming from mainstream medicine. It was started by a group of doctors in the US, and we are following that. We have done and learned for the last 5 years the aspect of modern medicine, of functional medicine. It is a new roadmap, it's a new GPS which is guiding you through a new terrain of a unnecessarily created, chronic illness. So here we look at it's a system biology, science-based medicine, and it also tells us how our genes interact with our lifestyles, our environment, our nutrition, and our mental attitudes.
Right.
It's something which restores the balance between the disruption of the balance and harmony of our bioregulatory system. What are those? We have bioregulatory system, it's a self-understood word, which is running in our body without our control and command. And these systems are not defined by geographical locations in the body or by systems. That means we don't have a respiratory system or a coronary system or a kidney system. These are a network of integrated and interconnected systems, and which are dynamically interacting with each other like an orchestra, where the gut is the main conductor and
Yeah.
the mind is the junior conductor, and every other organ is a piece in the orchestra. Okay? And what
Wonderfully put. Wonderfully put. I said that's wonderfully put. That the gut is that's brilliant. Absolutely right.
Yeah.
And it's one holistic orchestra.
Yeah, and the gut is actually the leader here and not the brain. The gut has the second brain. And even if we transect the spinal cord, the gut still rules it. It's like, the brain is like the lieutenant governor shooting a signal to the gut. And the gut is like the chief minister shooting back another 9 signals. So, the gut is still the main guy. And the reason that 80% of our immunity lies in the gut, nobody knows that. So the gut is not even an organ, but it behaves like an organ. 80%. Yes, there is immunity in our lymph nodes, in our bone marrows, in all the spleen and all the brain and all the other things. But by dint of having 40 trillion bugs in the gut, we have something like 250,000 genes. And you know how many genes you and I have? 26,000.
Wow.
So if we made a coalition government with our gut microbes, we would be winners. So sometimes I joke and say, are we bugs having a human experience? I make another joke and say that when we poop, we become more human because we let out some bugs. So we have to feed our bugs, and that's the main thing. So the gut is the main guy, and the mind is the main thing, not the brain. So that is what it is. So now we go to find out. We look at the whole person. We don't look at the symptom. We go to find out where did the imbalance start from, and what was the cause of the root cause. Right?
So let me just ask you, in chronic conditions, because you said, and it's true, like if somebody's having a heart attack or if somebody is, needs emergency care, then allopathic is the way. But for chronic conditions, there's also another aspect, Doc, because everything that we're having taking in, there's also the side effects of all these pills, right?
Yeah, I understand. So that is why, that's why I said that we do give pills and important things to stabilize the person to our need, and then we pull back all the pharmaceuticals. Okay, so therefore, what we are doing is that we are actually finding where the symptom, what was the imbalance which caused the symptom, and where inflammation starts. Now, the word inflammation is a bit confusing. Everybody thinks of inflammation as a red, hot, swollen thing. In our dictionary, an inflammation is a smoldering, symptomless, inflammation, which picks up A, B, and C. Depending upon your lifestyle, your nutrition, your attitudes, you will get an illness. And so we have to find out where did the inflammation start and who put the gasoline on the fire. And from there, we trace our way backwards from below into the whole thing. So that means we are looking at the terrain. We are not looking at the plant. We are looking upstream for a cause which is presenting downstream as a bunch of symptoms masquerading as an illness.
The manifestation,
Medicine of why. Why did this happen? Not what is the name of your disease, irritable bowel syndrome, autoimmune syndrome, chronic fatigue syndrome. What are syndromes? Syndromes are the collection of symptoms or diseases. And which is why I said to you earlier that we don't have any diseases here.
Yeah.
Because a disease can come from one disease may have multiple causes, and
Yeah.
one cause could be at the root cause of multiple diseases. So for us,
Absolutely.
a format, it's like a thing where we sit down and work out where did the inflammation start, and then based on what you eat. So we made a pyramid. The base of the pyramid is our structural integrity, at what our bones, what sort of signals is giving to the body. One side of the pillar is our mind. Another is
Yeah.
what we eat, drink, or breathe. And the third is the electromagnetic forces and the toxins which are writing us. So this is the way we do the whole thing.
Doc, repeat those three again, please.
So the
The
base of the pyramid is our structural integrity.
yeah.
One side of the pyramid is what we eat, breathe, and drink. The second
Okay.
pillar is how our mind handles our body or our illness or whatever we are. And the
Yeah.
third is the electromagnetic forces and the other toxins which we are riddled with. So in our systems, as we said, we find out why, why was cholesterol made? It was not due to a statin deficiency. I also joke and say that was erectile dysfunction Viagra deficiency? Is disease a drug deficiency? No, it's not. I mean, why are we
Yeah.
looking? We're very good at naming diseases, but we are very bad at putting things together.
Yeah.
So this is the
That's
whole thing. So in our case, in our dictionary, what we have done is we have set a core imbalances or systems by which we work. So we don't have any systems. Our systems are number one, nutrition. Number two, the gut microbiome. Number three is our hormonal balance, our detox balance, our inflammation balance, metabolic balance, our structural integrity, our psychospiritual integrity, and epigenetics. These are our systems. Now imagine I lay you bare on all these systems and I will know exactly where you are, how you are functioning,
amazing.
when the problem arose. So I don't care what your illness is. You could be having cancer, TB, or sarcoidosis. My approach starts from ground zero.
How
Right?
amazing, Doc. Seriously.
So this is the most important thing. So we don't go by diseases. We just see how our DNA and all the in external environments wash over these systems and how it converts our DNA and our genes, and that's how we look at it. And we have a very interesting way of looking at it. See, it's a very proactive medicine, very personalized. The way we measure what we do is very interesting, and as a result, we find we have sort of a preventive situation, so we can predict what is happening. We are measuring and mentoring the patient and holding the patient, and ultimately we finally work on four principles. Once we have measured it, we call it the 4P and the 3M. That means personalized and then participatory and preventive and predictive. And then we measure, mentor, and monitor. And finally, what we do is we find the problem. First, we remove the problem, remove the diet,
Yeah.
remove the bugs,
Okay.
remove what is wrong, remove the toxins. Then we replace what is lost, like digestive enzymes, bile, etc., etc. Then what we do is re-inoculate with probiotics, prebiotics, and finally repair. So you understand, it's a very, very comprehensive method, a
It's a
very
very holistic. I mean, you're really doing a 360 of and really going down to, and I love what you said even about the predictive, because the epigenetics and the predisposition all correlates to how something is going to manifest.
I want to say a few words on epigenetics because epigenetics is in our hand. What is
Yeah.
epigenetics? It's the study of how our genes are expressed. Now, remember one thing, our genetic code has not changed for 30,000 years. So we are stuck saddled with the DNA of our ancestors. So we have to respect our ancestral past. Whatever we do, we have to, regenerate our body at the cellular level as long as we keep the environment, mental attitudes of the past. So we are in sync with evolution. And this DNA of our past, we are stuck with certain attitudes, with certain biochemical processes which we can't change. So we have really it's like a disruptive technology in one end, and it's because we have changed the whole tyranny of diagnosis. There is no diagnosis. There is only inflammation, and who put the gasoline on the fire? That's our two dictums. So that's how
Wow.
we started.
So
So we
this is,
don't.
I mean, also the anatomy of an illness. You've really drilled it down to, that's amazing. Inflammation and who started the fire, really.
Yeah, and the interesting thing is that here it's a form of medicine which is born out of mainstream and allopathic medicine, and we still don't name any system. It doesn't matter whether you have a heart problem or a kidney problem or a gut. Everything starts from the gut, and everything we work backwards from the ground till we reach to the final answers. And we always do.
Right. So, Doc, I'm going to ask you. So, you have just recovered from COVID yourself, right?
Yeah.
So, I want to ask you, what was your protocol during COVID and post COVID? So, can you just help us, since we're in the midst of a pandemic, and I know a lot of our viewers are either already have COVID or are recovering from COVID.
I hope everybody's understood to some extent what is functional medicine.
Doc, you're going to have questions in a few minutes.
Sure. But anyway, so you see, we all started the protocol by learning and listening. Remember one thing, that most of my practice in COVID is based on mild to moderate to early severe illnesses. And I make that distinction of when to send the person to the hospital, or if they can't go to the hospital, we arrange a lot of their work at home. So that's where I am with COVID. So we started with what we call there is a protocol which is made by Paul Merrick, and it's called the MATH protocol. And MATH starts from methylprednisolone, ascorbic acid, thiamine, and heparin, MATH. And then, because it was more, then they added the MATH plus, and now added the MATH plus plus. So everybody knows everything about the ivermectin and the azithromycin and all that. The difference we make is that I have added vitamin C in a different manner. See, vitamin C is a very important component of our program. We have even given IV vitamin C. I'll come to that later.
Okay.
But what we have done is that most people are taking a single dose of vitamin C. So the difference is that the vitamin C's half-life, which means 3 hours, most of the vitamin C is lost and gone. So that means we do not have the luxury of keeping vitamin C in our system running. You will be shocked and surprised that when a person gets into COVID, we make it 2 tablets, 3 tablets, 3 times a day, 4 times a day. And in a cytokine storm, we give IV vitamin C. And guess what we do? You want to?
And sorry,
I
you
want
broke
everyone
up.
to put a hand on their hearts, because it might jump out when I tell you the dose of vitamin C that we do. We do some tests which are called G6PD, which if it is absent, that enzyme, then we don't do any high dose, but we are giving a minimum of 25 grams of vitamin C 4 to 6 hourly, and in the cytokine storm, it goes up to 50 grams 4 hourly. Now, you are 500 milligrams we are giving you. Now, this is shocking. It is not practiced by anybody. It was always there. I don't know why it is not being used. It is used for septicemia. We have saved millions of lives, not in hospitals because it is not allowed in this protocol. We have done it in homes. We have done it in small nursing homes. And I've done it in vast places of India because our functional medicine doctors are all over. You may have seen a video of one guy called Dr. Digambar Naik. You may not have. But
No, I haven't, Doc.
He was dying. His saturation was 48. With folded hands standing on her head, we convinced people there to do it, and he's fine and alive. And he had heart problems also, and that's what we do. I've also.
That's amazing. That's amazing.
Tablets of vitamin C in people who A, can't afford it, or B, where the protocol does not allow vitamin C. So what we have done is I have taken 8 tablets of 500
vitamin C.
4 grams every 2 to 3 hours till you are actually passing stools like a madman. That tells me that the matter is done. It's uncomfortable, but you save lives.
Yeah, and then the toxicity is coming out that way. Is that why?
So vitamin C, is an immune modulator. It's an antioxidant. It's an antithrombotic. It's an antiviral. It reduces all your inflammation markers. It gives you, it gives instructions to the cell to die. It's called apoptosis. It also, it's vitamin D receptor. It takes care of the chemokines and the cytokines. It even increases the nitric oxide, which is my next point. So I'm sure this has come as a little surprise and a shock that we have used such high doses. And even the time that I was ill for 10 days, I took 25 grams of vitamin C every day of my life.
Amazing. Okay.
The next thing that we bring up something which don't people don't know is NAC, N-acetylcysteine. I'm sure a lot of people have heard about it. It's told as mucinex, and everybody knows that mucinex is something which breaks up the phlegm and makes it liquid so that you can be expelled. That's the only thing that people know. And also we give it when we have to give dyes and to protect the kidney and the liver. So
Right.
what we see is that it is one of the biggest detox agents in the body. It is an anti-inflammatory, it's an antioxidant, it raises nitric oxide, it does immunomodulation. It also is the precursor to the only real antioxidant that our body makes. It also, changes certain inflammatory markers and all the inflammasome which is there. So for me, NAC is a brilliant medicine like vitamin C. And I give it for at least 3 weeks orally. Then when people are not good, then there's a IV version which we give intravenously. So I took intravenous NAC followed by glutathione. What is glutathione? It is the only antioxidant our body makes. So
Okay.
IV NAC followed by IV glutathione and then followed by 25 grams of vitamin C. That was an everyday affair. And then on alternate days, I used to use some other things which are called alpha lipoic acid, which strengthens your muscles, strengthens your nerves, carnitine, which builds up your muscle. So that is how I went through my 14 days of.
Of COVID.
Okay.
Okay.
So did vitamin D. Now I want to say a few words about vitamin D. Vitamin
Right.
D is not a vitamin. Okay, that's the third shock I'm giving you today. Vitamin D is a hormone, and we have to be thankful to the universe and to God to give us this sunshine hormone. This has about 200 plus advantages in our body. It's not a vitamin. It is nothing to do. That calcium absorption from the gut is one of its small properties, and we think that is its only property. So what we do is we give close to toxic doses of vitamin D just when a person gets COVID, so that it becomes like an immune booster. It's like a triple vaccine that we have given, which is harmless. And people worry about it. Doctors worry about it. Everybody says 25 to 30 grams is enough. But even in the brackets is written that 0 to 100 is allowed. At least come to 100. You
Yeah.
know. So vitamin D for us is the third big daddy in our dictionary. And how to get more vitamin D? Everybody, all our golfers says, oh, I play golf every morning. Vitamin D is not absorbed at that time. I have a little biohack that when your shadow is less than half your height is when you are getting the maximum vitamin D. So the best way to get vitamin D is to take off all your clothes and run around 12 noon. It might give you a heat stroke, but you'll get enough vitamin D. Okay. Another thing,
Doc. Yeah.
armamentarium, which is coming as the fourth shock of the evening, is melatonin. Now, hands up all those who think that melatonin is a sleeping pill. Everybody thinks so. First of all, it is not a sleeping pill. If you take 1 kilo of melatonin at 12 noon, you will not sleep. But if you take 2 tablets around between 7 and 10, it will induce sleep. It is a sleep inducer. So to give you an analogy,
Yeah.
melatonin is the guy who says, on your marks, get set, go. Boom. So he doesn't run the race. That's melatonin. So now melatonin has the same properties as vitamin C, but even more. Scavenging all the muck that the virus has collected. It's also producing nitric oxide. It's also doing all the anti-inflammatory immunomodulatory jobs. And believe it or not, I take 12 milligrams. That means 2 milligrams in the morning. That's 4 and 8 milligrams at night. And people laugh at me. And the post-COVID syndrome also, I've taken up to 18 to 20 milligrams to prevent COVID. So that's again another big daddy issue which people don't know. Well, another thing that's come up is a drug called fluvoxamine, which is an antidepressant. Now
Yeah.
it is competing with ivermectin also, that which is better.
Yeah.
Anti-androgenic drugs, something which people use for prostate control, and even people who have difficulty in passing urine is doing a great job. And people are using that a lot. And we are also using, along with ivermectin, we are also using another medicine called nitoxinide, which is another parasite killer. So we are using ivermectin, nitoxinide, and azithromycin together. Another medicine that we use is quercetin. I know everybody's heard about it. It's found in, little QUERCITIN. It's a very important anti-inflammatory and immunomodulator. It prevents the entry of the viruses, replication of the viruses. So I use that as well. I mean, I can give you the details later.
So,
Now,
Doc, yeah, I'm just going to interrupt you because we're almost at the end of our 30 minutes, but we haven't even started the audience questions, Doc. So can we? So if before we take the audience questions, if you had to say something to everybody, what are the 3 must-dos during COVID? During COVID and then 3 post-COVID. Let's just sum it up for
that's really difficult. But as I told you, I've given you 4, startling informations about the dose of
Yes, you
vitamin.
have.
Yes, we've given you about NaC. We've talked about nitric oxide, and the nitric oxide we can inhale. We can even do Brahmari, and humming increases the nitric oxide to a great degree. We have also used, because I didn't get the time to complete it, another shock is methylene blue. Now, methylene blue is, nobody knows about it. And we use methylene blue, and we have saved hundreds of lives like that. You can take it sublingually, you can take it as an inhalation, you can take it as a nebulizer. So these are the new different things that we do. I have to include ozone into it because I did ozone breathing every day, passing through olive oil. But ozone can be given in many other ways. Interestingly, it can be given IV. We take out person's blood, we mix the ozone with it, and then bring the blood back again. We also give rectal ozone because that is the quickest and the easiest way for getting COVID out of your system. We even have places which are ozone pods. And post that, we put people in infrared saunas or near infrared saunas. I have one in the house, and I sit down it, and it is not like a hotel sauna. It's nothing to do with that. It leaches your toxins out. And once you do that, then we give IV therapies. So you pee out the rest, and then we give you ozone to back it up. So what I'm trying to say is ozone, high dose vitamin C, vitamin D, methylene blue, and hydrogen peroxide. So sorry. What about that? Hydrogen peroxide we mix in a particular, I can give you the details later, little bit of hydrogen peroxide, little bit of saline, and we can have it in a nebulizer. We can have it even a food grade hydrogen peroxide. So according to me, these 5 items, I don't need anything else. I can treat the whole corona business just with these 5 items.
Wow. Doc, so at the end of this, we will take you up on that, and for our audience, we'll just put together something and share with everybody. Doc, can I start with the audience question? Everybody has asked me one thing that I have to ask you, which I'll take it very quickly. Why are people having heart attacks post-COVID?
Doc? The thing is, the post-COVID syndrome is a very wide syndrome. As we know, CNS disorders, muscle disorders, gut disorders, mind disorders. I'm not going into that because every organ is involved. But what I'm seeing in this particular variant, that there's a lot of heart disease that is happening, and 95% of the heart disease comes from a condition called myopericarditis. Myocarditis is inflammation of the heart muscle, and pericarditis is inflammation of the covering of the heart. Now, the inflammation is the basic cause. Now, inflammation theoretically can happen in the coronary arteries, but we are not really getting heart attacks actually. There are heart attacks because the people who have already some blocks in their coronaries, the coronaries, when they get inflamed, that's the time when they attract a clot. So it's the clotting inside the coronaries as a result of the inflammation created by the coronavirus. But majority of the deaths that are occurring from the heart are due to dangerous arrhythmias. Ventricular tachycardia, multifocal atrial tachycardia, heart blocks, slow rhythms. It's blocking the conduction system of the, the heart has a pacemaker which God gave us, and from there, nerves are innervating the heart and causing it to, function. So either you can get slow rhythms, so slow that no blood goes into the brain and you collapse, or so fast that the heart cannot pump blood to the body, so you collapse. So majority of the deaths that are happening are not pure heart attacks, but they are due to rhythm disorders. So I think that everybody is shying of getting these tests done more frequently. That means the D-dimer, the CRP, the CPK-MB, which is an enzyme of the cardiac muscle, troponin I and troponin 2, which are again enzymes of the heart muscle, a very, very close echocardiogram. And there is another angle to the echocardiogram, which is not being done anywhere. Of course, in the bigger hospitals, they do it, but people are not doing what we call a systolic longitudinal strain by measuring that. And in people who we detect, where we detect the arrhythmias, we are insisting on getting a cardiac MRI, because only a cardiac MRI will tell us how good or how bad the myocarditis is. And based on that, we use colchicine. Now, colchicine is a drug which is meant for gout, but I use it as even in COVID. So also we have to use other inflammatories, blood thinners, platelet modifiers, and antiarrhythmics. All of them have to be monitored very carefully, and we have to continue repeating this test to see. And if the MRI is involved, we may have to give these medicines for 3 months. And that means people who are severely involved with cardiac muscle disorders may get into a fatal problem right up to 12 weeks as well.
Okay, so for stabilization, this protocol.
This is a plea to all the people. Don't do any fancy. I mean, I know we are all addicted. I'm the biggest fitness freak in the world. I have not done anything that. Do not fall prey to this. I have 2 patients who did the yoga standing on the head and doing funny postures. They're putting their legs through their nose. But they all got into trouble and they were in hospital and very sick. And we have so many incidents where people died while they were doing fancy, aerobic maneuvers.
Right.
That is the reason. So please take care. This is the only thing which you can pop up in a second. You get an arrhythmia called ventricular tachycardia. In a minute, you're gone.
Thank you, Doc. Okay, we're starting with the audience questions. Doc, I know we have already passed our time. Will you give us another 15 minutes, please?
I can give you another hour.
Oh, wow. That would be brilliant. So for our audience, whoever would like to stay, Doc is available. Thank you so much. Okay, so I'm going to start with the questions. From Brinky, we've got, post-COVID, I have pain around the sternum and headaches. Is this normal and how can I cure it?
See, now, typically a heart attack, can you see me if I stand?
Yes, we can see you, Doc.
This is the area of the heart attack or the heart pain. And heart pain is very rarely on the left side of the chest. Here you get a squeezing sensation, which is anybody who points their finger, I already know it's not a heart problem. So, a squeezing, constricting pain in the lower central chest, which can come at rest, but more likely happens at the peak or height of exertion. It can go up to the neck, into the jaws, throttling sensation here, and down the arms. Now, this is the entire gamut of angina, which means that angina is not coming from actually the heart. It is a referred pain, which can typically come here, go to the jaws, go to the neck, and come down the arms. Now, it doesn't mean that every arm pain is a heart problem. So everybody comes to me and says, oh, I've got an arm pain. How long? Oh, it's been there, coming and going, for 5 days or 6 days. I said, the heart pain is not like a pataka which you put on, who tells you that, listen, why don't you go and have dinner, and I'll wait to come out and then I'll burst. So
you're so cute. What do I say? It's true.
You have to find out the temporal profile of the angina, a temporal profile of how it came, and the fact that it goes away completely, which you can't look at. That means any pain that you can touch, any pain which increases, decreases, modifies on turning, twisting, eating, drinking, is not heart pain. You cannot touch it. I mean, if you touch the pain and it hurts, it's obviously a local problem. So please be aware. At the same time, a big mimicker is the esophageal spasm created by gastric reflux. So please be wary of that. Some people call it acidity. But the thing is that acidity or reflux will only happen at rest, whereas angina happens during exertion. Yes, you can have heart attacks at rest. I'm not saying that. But typically, you will have a history of acidity, burning, heartburn, and you get a spasm like that, which will mimic heart attack.
Okay. Justine is asking, can functional medics be used to cure diseases like liver cirrhosis and Alzheimer's?
Yes, you see, I'll tell you in order of importance, which are the easiest to do. The easiest to reverse is diabetes.
Really?
And, yeah, I've done more than 1,685 in the last 2.5 years.
I'm sending my dad to you.
Yeah, medium to chronic heart disease, coronary disease. Then aging, we have a great protocol for aging. Cirrhosis, wherever you have a functional change, a structural change becomes difficult to convert. We can stop the progress. We cannot convert a scar which is already present. By the way, some of our post-COVID protocol, we have also used for reversing fibrosis in cirrhosis, or even if you can't reverse it, we can make it better. So definitely you can't take it out like you're taking an appendix. So functional medicine is a magical approach, but it's not that magic that we can convert, we can do everything. But the thing is that if you practice it properly, if you do it sincerely, a very large number of diabetes, heart disease, autoimmune disease, aging, everything really works. And especially hormonal disorders, because the
Right.
hormonal disorders are controlled by the thyroid gland. And everybody thinks, oh, one very big thing I want to tell you today.
Please.
The way we are doing a thyroid test is a four-letter word, starting with J and ending with K. It's junk. Nobody told us in medical school that T4, the thyroxine hormone, and the same thyroxine medicine you give when you have hypothyroid is not the active hormone. It is T3, T1, T9, T11. We didn't even know all that existed. We met one gentleman called Daryl Tester who's on our board. He has been nominated for the Nobel Prize for research on thyroid. He has given us this equipment
Wow.
to actually do a personalized thyroid program. That means we do not, if I and you have got thyroxine, we will use the same medicine. We will use that L-toxin or Thyronol. But no, we are making thyroid hormone from compounding pharmacies, from plant-based sources, which will only bring for Bhavna. I cannot take your pill if I am a thyroid guy. So we are making that, and that's how we are treating thyroid. And the main metabolic organ in the body is thyroid. Once we treat the thyroid, and you may have a perfect record by the conventional method, but the thyroid will convert a very large part of your metabolism and convert a lot of diseases. So please, I have found that a very large number of Indians are hypothyroid, even when the tests are normal. So I really wanted to make a point here.
No, I'm glad you did, Doc. Thank you very much for that. Okay, if somebody is experiencing palpitations post-COVID, what should one do?
This is a very important question, because when you are experiencing palpitations, many times people say, "Okay, Doc, I've got palpitations." What does palpitation mean? It means that I can hear my heart. Now, a lot of people are now getting scared. Palpitations is a generic word. What we are looking for is irregular heartbeats, sudden skipping of beat, a little thumping of the heart as if the heart is lurched downwards, or a sudden, very fast like that. It's not something that you are aware of. Many times people say, when I lie on my left side, I can hear my heart. So that's awareness, that's anxiety. But to be on the safe side, please get an electrocardiogram done. But the electrocardiogram is a very sort of a useless item until you are detecting the problem when you're getting it. So we today have a thing called the ELR, which is called the external loop recording. We do it for 1 day, 3 days, 7 days, 21 days, and it can record your entire thing. We can then replay it and look at it. We also got a real-time ELR, which means that we fix some figures, and the moment you get a problem, it immediately will alert me, and I will call you and say, come here right now. I mean, in COVID times, I remember I was overseas, and it was about 3 a.m. in Delhi, and I was told that this is it. I woke up that guy who was blissfully sleeping, and he would have died if I hadn't contacted him. So this ELR is a great, it's not some invention. It was always there, like a Holter monitoring.
That's amazing. Yeah.
It's a little modified version of the Holter thing, where we can watch, and in a central console, everybody's ECGs is being recorded, and we get alerted to it. So please pay attention to it, but don't overly get excited about it too.
Right. Okay. Doc, thanks very much. From Nandini, can functional medicine help a patient who is on dialysis?
Very difficult, because that is the tough part. We don't normally take people, but what we can do is we can make their life very happy. For like the similar thing, because you see, again, it's a structural damage. Once the structural damage is done in an organ, that becomes difficult to do. That is why I said that heart disease, diabetes, autoimmune disease. Now let's take the answer is not exactly, but we can make their life much happier by giving them so many things that we normally do. The other thing is about cancer. Now, we are treating a lot of cancer patients, but with close conjunction with the oncologist. What can we do? We can actually treat people who say that I will not take chemo or radio, come what may. So, also come to us, and we have had good results. At the moment, I'm treating about 15 cancer patients. They're doing well. But majority of the patients are those who we do in conjunction with the oncologist. We ask them, look, we want to do this. Can we do it? They say yes or no. But we make their life very, very happy. We make their terrain very happy. We make them functional. We reduce the dose of chemotherapy. We reduce the, the duration of chemotherapy. We put people on, for example, I put people on 30-day fasting, only on
Yeah.
water, with bone broth and tea and, certain things. The cancer cell dies, the guy doesn't die. So we do a lot of things which are doing it, and in cancer treatments we have used 1 million, and really 1 million off-label uses. You'll be surprised and shocked to know, like for example,
Wow.
there's a medicine like cimetidine. So cimetidine and atorvastatin for cholesterol is being used more for post-COVID syndrome. I'm using statins for I'm not giving any statins to heart patients, but using it for a post-COVID syndrome, using it for cancer. There's another medicine called naltrexone, which we give for opium addicts, 50 milligrams. We found out that 2 milligrams instead of 50 milligrams can treat the post-COVID, can treat cancers. So, we are finding
Amazing.
a lot of off-label uses, like I told you about melatonin, I told you about NAC.
Yeah.
So many of our medicines which we are using, which are not medicine. Typically, now let's take a thing like Monter LC or Famosid. Now,
Yeah.
everybody is anti-allergic. It is, but
Yeah.
it's an H1 blocker antagonist, which means that it is blocking the entry of the virus too. So you're
Wow.
not taking it just for a cold. Similarly,
Yeah.
the Famosid is the H2 receptor blocker. So apart from the acidity issue, it's also blocking the viral entry. So if people agree, and I know I give a lot of pills in that, but if you want all the advice and all the things, why not have it? It's just a week or 10 days of taking a lot of pills, and all of these pills have a very decided, proven action for COVID.
That's amazing. Doc, from Dheeraj, what about the role of vitamin D and zinc in addition to the math protocol?
You see, vitamin D, as I told you, is not a vitamin. It's a hormone. It is the biggest immune agent. There is no other bigger immunity that you can get. Our autoimmune protocol is that we are even giving vitamin D at 175 or even up to 300. That means 3 times the toxic dose. But we watch where the calcium is going, where the parathyroid hormone is going, and we are losing that game. Yes, it is not right, but since we monitor it, we can do it. So vitamin D, please respect it. Bow down your head to vitamin D. It's a wonderful thing. Zinc. Now,
Okay.
here are a lot of things, people are saying that people are giving zinc and all this nonsense. And there's so many people on
Yeah.
TV who are junking this. Zinc is an ionophore. Ionophore means that it takes vitamin C and many other chemicals from the outside into the cell to the place where it's needed. And on its own also it's got antiviral properties. But don't mix your vitamins, please, for God's sake. We know all these multiple vitamin C with zinc. No, every vitamin should be separate. And all these multiple things where you look at 100 little things which you can't even read. If you find more than 5 ingredients in anything, now throw it away. If you can't pronounce 90% of the things, throw it away.
Okay. So, Doc, what's the dose of NAC orally?
600 milligrams twice a day.
Okay. From Arjun, pre-COVID, just to share as a preventative, pre-COVID has given me 20 grams of vitamin C every week, glutamine through IV, been taking it last 10 weeks.
Is this Arjun Sharma?
I'm sorry?
Who is this, Arjun Sharma?
Yes.
Yeah. So Arjun is a very wonderful, happy, and very open recipient of this program. He's understood it very well. He's very open to it, and you can see him looking happy and smiling because he has taken the whole nice brunt of this wonderful program. So 25 milligrams, as I told you, I took it every day during my COVID, every day. As I told you, I took NSC and glutathione, followed by vitamin C, 25 grams, followed by ALA and carnitine every day. And now I'm doing it twice a week.
Right. Thank you so much. Actually, my cursor was stuck, Doc, and I couldn't complete his thing. Yes, he's been on your protocol for the last 10 weeks. That's wonderful. Thank you for sharing that. Then we've got, I had mild COVID and my daughter was high about, let's just skip this, Doc. 1 second. What's going on with this? Okay, what about the hypothesis that COVID causes a prothrombotic state that leads to a heart attack versus a cardiac arrest due to myocarditis?
Yeah, I just talked about it. You see,
Yeah.
every complication of COVID is a thrombosis. See,
Okay.
every other theory is junked. The whole story is that every organ, every vessel, every artery is blocked by a clot. So a clot is the basis of lung disease and it's the basis of every complication. So we have to be very cognizant. In fact, my protocol is that if you have a, like the D-dimer, even if it is more than 50%, even within range, I start a low dose of that because I know that we will not be able to follow everybody perfectly and they may proceed into a coagulopathy state and we may, lose that patient. So it's a very important thing to start it. There are a minus, there's a question of, over bleeding and everybody who takes a large number of patients are taking blood thinners. So one of my plea is that stop brushing your teeth. Just rinse your mouth and do some coconut oil pulling in the mouth,
Yeah.
and so that will and stop putting fingers up your nose or blowing your nose because we don't need to brush our teeth. We don't need to blow our nose. No need. Blowing your nose doesn't help. So don't take anybody who's on these blood thinners. Be careful about scratching a scab or the brushing your teeth. People are brushing their teeth for 15 minutes. I've noticed a lot of them.
Yeah. Right. Doc, two things. One, we got so many messages from a bunch of people because we hit our capacity. And so there were a number of participants who, have not been able to participate. Plus, we've gone over time by a lot. But we'll still continue with more questions because, you were open to that. So Sushmita is asking, can we treat or at least manage multiple sclerosis with functional therapy?
Yes, you can. So again, we don't promise because multiple sclerosis have, 5 or 6 different mechanisms, and we never realize that how sleep can help, how we removal. Oh, by the way, I want to say something about neurodegenerative diseases that,
Yes,
we have
please.
another equipment with us which measures the amount of metals and minerals which are toxic in exact proportions. And we chelate those metals. Chelate means leach the metal out from the body out into the system, put them in that infrared sauna, give them ozone and take it out. So we are in the business of actually leaching out these toxins and these heavy metals. A lot of that heavy metal is seen in MS. And all the basic neurodegenerative changes, we put in large doses of intravenous CoQ10, omega-3, vitamin C, melatonin, and these off-label uses that I told you, are also we use that. So we make a very good deal of it. They get better. I mean, 100% conversion sometimes does happen, but there's sometimes you get into a complete remission. So it's a nice game because it's just repairing the biochemistry. You see, our job
Yeah.
is to repair the biochemistry. So really, we look at what the core imbalance is. Then how do we change the physiology, and then how do you take the environment, nutrition, toxins, and everything is very simple, and functional medicine is very simple.
Okay. We have a quick question. Why is it important to keep temperature low and not
Very good question.
COVID? Yeah.
Very good question. I see a large number of doctors will write, they've written paracetamol or dolo to be taken regardless of temperature. Written regardless of temperature. Now, temperature is a body phenomena.
Yeah.
It's like saying that I've got diarrhea and I put a plug and stop it. I mean, it's as ridiculous as that.
Yeah.
Now, obviously, it doesn't mean that if you are sick, you are upset, or you are headache, you can't breathe, and you're pain. By all means, take it. But to this extent that you can manage. Now, I didn't take a single antibiotic throughout this COVID of mine, not at all. So,
Wow, doc, that's amazing.
do not take it unless you really need it because it's good for us. It's killing the virus. It's a body. It's like, okay, now again, this anti-allergics for sneezing is actually putting the allergy back. Like people take this Imodium for diarrhea. What for? You want that damn thing out or you want to put it back in? So that's it.
Okay, doc, can functional medicine help
Fibromyalgia?
Yes.
Yes, 100%.
Okay.
Fibromyalgia is at some level a psychosomatic illness. And in few lines, I can explain that if you like.
Yes, please do.
See, there are many psychosomatic illnesses, but most people think that psychosomatic, I'm telling it's a psychological thing. That is psychogenic. That means if you want my attention, you will say, oh, doc, I've got this miserable headache. I can't even think. I can't even breathe. But that is psychogenic. Psychosomatic is that the illness is real. Let's take the example of fibromyalgia, or maybe typically easy example is tennis elbow.
Yeah.
Now, what happens is that this originates in the subconscious mind. The subconscious mind is the home of all your animalistic and banal desires, crushed emotions, suppressed rage, unfulfilled ambitions. And the subconscious mind knows that you're in trouble, so it opens up its dabba and puts it back again. And it emerges in dream states, contemplative states, and things like that. It also, what it does is that it knows that you are in upset, you might jump from Qutub Minar, so it will reduce the blood supply and the oxygen to your left elbow because it knows you are a left-handed tennis player, and you say, oh, you know, I've got this tennis elbow. And not only that, your tendon will be broken and frayed. And when you get better, there is no change in the broken tendon. And you always, I mean, I know this guy who said, you don't know how to treat this, and I'm going. I met him after 6 months, and I asked him, how is your family issue and your factory? He says, now it's okay. How is your tennis elbow? He says, it's okay. I said, what did you do? If I think about it, nothing. Answer. I said, can you do your MRI again and see it's looking just the same?
Yeah.
Even a disc problem. So similarly, fibromyalgia, a little more difficult to treat, but because there's a huge mind involvement in it, but yes, it can be fully treated.
Wow. So psychosoma, I mean, it's psycho is mind, somatic is body. So real manifestation of a, yeah.
There's so many diseases that are psychosomatic which we think are real.
Yeah. From Siddharth, we've got, hi, I was reinfected with COVID, but my doctor did not treat me. He just asked me to nebulize with Buricort and Duolin. Although the symptoms disappeared in 4 days, I still have cough and sneezing. My antibody count was 291 3 days after my symptoms disappeared, but my RT-PCR is negative.
Well, I think your doctor was very sensible because there have been a lot of studies. There is one doctor in Canada and also in the US who has done nothing but Budicort nebulization. And done it very well, and people have recovered. I mean, of course, there are times when you need a digital thing, but in this setting, this was the right way.
Right. Okay. Then we've got relationship between B12 and gut health.
Oh, that's the subject which will be never ending.
In a nutshell, Doc, and then we'll let you leave. But we'll get you back for sure.
First of all, most people have spent most of their lives suppressing acid. You know, nobody has realized that God made acid for some 10 good reasons. The few of them are that best antiviral, antifungal, antibacterial. A particular pH in your stomach is needed for the digestion of protein, and the proteins will not get digested. A particular pH is needed for the absorption of B12, zinc, magnesium. A particular pH is needed to maintain the mucus barriers. So people are taking, they say, Dr. Saab, acidity hai. And I ask them, what does acidity mean? They can't define it. क्या खा रहे हो? Pentocid. क्यों खा रहे हो? Gas होती है. और क्या होता है? Nobody talks about, something. What you are getting is actually reflux. So
Yes.
if your wall is leaking and you turn the tap off, you will have no water. Similarly, let's do measures to prevent the reflux. Do not suppress the acid, which is why I say that Pentocid is the number 1 or number 2 poison in our body. And we ask people, how long have you had acidity? Oh, sir, 25 years. What have you been having? Pentocid. Is your acidity better? No. What is the definition of insanity? To do the same things over and over again and expect different results. So this is something. Every doctor, if he gives more than 2 tablets, they add a Pentocid. What for? So your B12 does not get absorbed, and that is the simple reason is that you have not enough acid in your stomach.
Wow. Doc, we will wrap this up now, and you've been with us for an hour, and I really appreciate your presence here. And Doc, I'm going to request that you join us again because we are insatiated. We still have so many questions.
This is very dear to my heart. And, for me today, as I said, it's like a sense of service and a sort of a feeling the angst of people who are suffering from chronic disease. And all we are doing it is, sanitizing the disease by a mere definition of symptoms and saying, "Acha, aage jalo."
Wow.
नहीं कर रहे ना कि हम क्या करते हैं, टेस्ट करा लो, अच्छा आपका कोलेस्ट्रॉल बढ़ गया, उसको 10 मिलीग्राम ऐड कर दो जी, उसको माइनस कर दो जी, ये क्या हुआ? So I'm feeling this angst very much, and I want to help people as a sense of service. And I mean, I can stand today with my team of people and say that, I'm really sorry that we treated you wrongly earlier, and I really want to say that we lay so much blame, judgment. Instead, we should have given more care and more, empathy to see that, because we are already humbled by the fact that we gave you wrong advice.
Doc, you are absolutely, I mean, I really, hats off to you. The courage it takes to say that and to really be authentic. So I really, really appreciate you in, I mean, not just as a thought leader, as a visionary, as a doctor, but really for coming here, for sharing your time, your energy, your wisdom, your experience, your everything with us. It's really been a beautiful, beautiful session. And Doc, I'm going to hold you to your promise. We will have you back.
Okay, thank you for having me and to let me share what is most dear to my heart. This is not the end. I'm going to do
No,
105.
till we meet again, Doc, we're going to have you back. CII and CII IWN all are in absolute gratitude. Thank you so much.
Thank you. God bless.
And thank you everyone who has been with us for Need of the Hour. Tomorrow we have with us Dr. Shalabh Sharma, who is an ENT consultant and surgeon from Sir Gangaram Hospital. And so we look forward to welcoming everyone back tomorrow. Thank you so much, Dr. Chopra, and thank you audience for really rocking it today. Thanks a lot.